The face of that frontline health worker so often talked about is mostly that of a woman. Now, according to the World Health Organization, more than 7 out of 10 global health and health facility service workers are women. Now, let's speak to one such woman. We are joined via Zoom, in fact, via telephone line by Sister Siphiwe Thibakgwana, a nursing sister in the Northern Cape. Sister Siphiwe, thank you so much for joining us this afternoon.
Thank you, Unati, for inviting me.
Always a pleasure. Now, Sister Siphiwe, let's me start by thanking you and your colleagues for all the hard and selfless work you've been doing for the country. Today, as you know, marks 500 days of lockdown in South Africa due to COVID-19. Now, as a nursing sister, how has your experience been during the pandemic? What were some of your challenges?
Unati, I don't know, fortunately or unfortunately, I never worked with COVID-19 admitted in the words. I was like, we were doing like the screening and the triaging outside. Do you understand?
Yes, I understand, ma'am.
Yes. So I don't really have the experience of a sick COVID-19 patient, direct nursing.
So one of the experiences that you've had with your colleagues, you've seen the long hours that they've brought in. You worked in the front lines with them in hospital. Talk to me about just how the mood was in hospital when you saw family members coming to visit their loved ones, even in hospital. I mean, you've told your family members yourself of just the hardships that you've seen your colleagues go through.
Unati, I saw anxiety, I saw fear. Anxiety and fear and not understanding this disease was the main thing. And not knowing how to handle the whole thing when everything started. It's a new disease, and it took time for us to understand exactly what was happening. And there was also a lot of confusion. But seeing members of the public, patients coming in with their families, the most breaking thing was that people couldn't visit their families in the woods like we are used to.
Sister Siphiwe, now that people are slowly starting to vaccinate and the country is easing into a different kind of lockdown that we saw in the beginning, in the initial lockdown, talk to me about how it is now working in hospitals. Are you finding it a little bit easier now? What is your experience like?
Unati, at the moment, I'm doing vaccinations. I'm allocated at a vaccination site. And I think the vaccinating has eased a lot of burden on hospitals, admissions, and also it's a great relief for the healthcare worker that people are now vaccinating, and maybe there is going to be some relief amongst us, and you know.
Now, you know, in Kimberley, we know that during the third wave, we saw the numbers peaking even before the ones in Gauteng, as an example. In the Northern Cape, the numbers were a little bit high. Talk to me about how serious you think people are treating COVID, and what is the message that you'd like to say to those people that are not treating the COVID-19 pandemic as a real threat to their health?
Unati, you know, in Kimberley, especially with the youth, we have a problem with our youth. They are not taking this disease seriously, this virus seriously. People are moving around without masks. People are in crowds. People are not social distancing. You know, and people are dying. Now maybe people need to experience people need to experience, personal experience of what is happening before they can respect the virus.
Now, have you yourself vaccinated?
I have personally vaccinated. We are the first to be vaccinated. And we are also vaccinating and encouraging and inviting people to come for vaccination. We are encouraging people. We are so happy that people are coming on for the vaccination. We congratulate them for coming. And we are also encouraging them to go and tell other people about the vaccination, because there is a lot of stories and fear about the vaccination.
Absolutely.
People don't understand. Yeah.
No, continue.
Sorry?
I'm saying continue. People don't understand.
There is a lot of stories and on social media, wrong information about the vaccination, how it's going to kill who, and all that. So it's a challenge.
Sister Siphiwe,
people are misinformed.
Sister Siphiwe, how are you and your colleagues doing mentally and emotionally? I'm asking this because I know that the hours in most hospitals have been changed so that you could accommodate, the influx of patients. How are you guys doing psychologically and mentally?
The major issues mentally is critical shortage of nurses, beds, medical supplies, including PPE, the personal protective equipment, psychological changes, and fears of infection among nurses, from patients to nurses and among ourselves.
In 2019, none of us in the country could have seen just the extent of what this pandemic was going to do and how it's going to change our lives. So, Sister Siphiwe, perhaps as we end our interview, what is the message that you would like to say to your fellow nursing sisters and everyone in the health industry at this moment?
My message, Unati, is that we should respect this virus. We should respect COVID. If we don't respect COVID, we have seen with our eyes, it will definitely disrespect you. We have seen, I told my daughter the other day that when COVID started, we used to see numbers here on the TV screens. Now the numbers are attached to names of people that we know. That is now the reality of COVID.
Absolutely.
Yes.
The cold face of COVID. Thank you so much, Sister Siphiwe Thibakgwana, for your time this afternoon.